This episode of No ME on long COVID diagnosis was recorded in November 2022 for ANZME's long COVID event. View the video to see the slides that Dr. Sarah Dial is referring to. View this on YouTube.
In August this year, I attended the International Association for Chronic Fatigue Syndrome conference via Zoom, and that included a really good workshop on long COVID. This workshop included Professor Jane Mackay from British Columbia in Canada, and they run a really large coordinated provincial network of long COVID treatment program, and they've treated more than 6,000 patients. In addition, there was input from Associate Professor Hector Bonilla, who presented results from Stanford University Long COVID Clinic, and they've treated more than 600 patients, so a lot of experience. In addition, our Ministry of Health have also recently published long COVID guideline for New Zealand, so I've tried to align my talk with their guidelines as well. So what is long COVID in the clinical case definition? Around the world, there's so many different terms and definitions that have been used during the pandemic. So around the world, we also call post-COVID condition, long-haul COVID, post-acute sequelae of COVID, or PASC, chronic COVID. In New Zealand, we're referring to this as long COVID or post-COVID-19 syndrome, and it has been asked that we can code that in our PMS. In terms of definitions, our definition that we're using in New Zealand is closely aligned to the NICE definition and the WHO definition. So that is signs and symptoms consistent with COVID-19 that develop during or after an infection, symptoms that continue for more than 12 weeks and that are not explained by an alternative diagnosis. What symptoms are we seeing? This graph or picture is taken from the Canadian group and their website down the bottom, which will be provided to you. And what you can see is that there's an awful large number of symptoms that occur in long COVID. These symptoms vary widely from one person to the other. They can develop, they can be kind of ongoing from the acute COVID-19 infection, or new symptoms can develop as time goes by. Those symptoms can fluctuate, relapse, and as I mentioned, change. There was a meta-analysis done that found 81 different symptoms had been recorded for long COVID. So this table here is data from Stanford University, Hector Bonilla, and it shows the rates of the most common post-COVID, long COVID symptoms. And as you'll see, the top 10 symptoms are also the predominant symptoms that we see in ME/CFS: fatigue, post-exertional malaise, brain fog, unrefreshing sleep. The bottom symptoms more specific for long COVID, with the more respiratory tract, upper respiratory symptoms. There's not yet a definite conclusion internationally as to whether long COVID is a particular phenotype of ME/CFS. In the Stanford group, 43% of patients did meet the ME/CFS case definition after 6 months. Other extensive research by Dr. Leonard Jason from DePaul University showed that there was the more severe your long COVID symptoms are, the more likely you are to meet the ME case definition. And one of the reasons for that is that in order to reach the case definition for ME, you need to have functional impairment, whereas that's not part of the long COVID case definition. So people with mild long COVID symptoms may not have significant functional impairment, which leads me on to this slide here, to consider how significantly the symptoms affect quality of life and functional. So this is from Stanford University, and the top two parts of this graph show that approximately 40% of long COVID patients struggled to take care of themselves or were bedridden. Data from Canada was reasonably positive, showing that by 12 months, lots of people were improving and there was reduced symptom burden for some people. I wanted to touch briefly on the symptom of post-exertional malaise or post-exertional symptom exacerbation. This is a cardinal symptom of ME/CFS and quite reasonably unique to that diagnosis, and also very common in long COVID. So post-exertional malaise are when you have symptoms that are made worse from physical or mental activities, and that can be exacerbation of a diverse range of symptoms, but most commonly worsening of cognitive impairment, brain fog, fatigue, and sleep disturbance. That worsening of symptoms can occur immediately after the overexertion, or sometimes up to 72 hours later. And recovery from that post-exertional malaise can take several days or weeks, often leading to this crash and burn cycle. So it's quite different from the, oh, I went for a long run and I felt tired the next day. This is significant symptom exacerbation that lasts for a long time. So how does the GP approach the diagnosis of long COVID? Probably takes several consultations to really get to the bottom of this. I think about a three-pronged approach. So the first one is to address organ damage that's resulted from acute COVID-19 infection. And this includes the more serious things that we want to rule out: heart failure, acute coronary syndrome, pulmonary embolism, and pneumonia, and rule out alternative diagnoses. The second part of the diagnosis is to formulate what the long COVID symptoms are with a view to symptom management. And finally, always important to address the psychosocial effects that occur from people with either having had severe illness or who have prolonged symptoms and ongoing functional impairment. And just worth noting that long COVID compared to ME/CFS has a far higher incidence of anxiety and depression occurring post-COVID. So the red flags that we look at to help rule out those post-acute sequelae of COVID causing organ damage are things like chest pain, breathlessness, unilateral leg swelling for vascular problems, severe headache, and important also as time goes by that we evaluate any really marked change in people's symptoms or new symptoms that develop, so that we're ruling out other illnesses. If you had any of these red flags, that would obviously lead us to the usual investigations, specialist referral, chest x-ray, echocardiogram, ECG, and those more specialised blood, ENP. So once we've ruled out red flags, then we want to try and get a handle on the long COVID symptoms. And I think this symptom map is really useful because, trying to get a handle on what symptoms people have and the severity and how it's affecting them is a really good way of doing it. This is in the Ministry of Health guidelines and has been developed by a physiotherapist from Taranaki. So you can see here that it lists a number of the symptoms, and patients can evaluate it themselves, their severity, and then also looks at a functional disability score. There's also long COVID symptom trackers, or just a general systems review can help define what the symptoms are. In terms of investigations, the group from Canada initially did really extensive examination and investigations for all of the long COVID patients. But they found that once they had ruled out the organ damage and serious sequelae, that it wasn't particularly useful. So simple examination, thinking about examination for orthostatic intolerance or POTS, and then a simple group of fatigue blood tests that we would normally do to rule out other illness. I think the next presentations are going to be focusing more on management, so hopefully that covers diagnosis of long COVID. Thank you.